say thank you to our brothers and sisters from SEIU for being here in support of us this evening. So we're here tonight because Minnesota nurses and nurses all over the country are worried about the lack of hospital preparedness to deal with Ebola. You're going to hear from the nurses who are frustrated and concerned because their hospitals don't have adequate Ebola safety precautions.
Whether the patient comes to the hospital with Ebola or enterovirus or just the flu, we need to know that we can be safe taking care of these patients that come through our doors. I want Minnesota to be a leader. I want Minnesota leaders to step up to protect the frontline nurses and the workers that are all caring for these patients. And if these words that I'm saying are falling on deaf ears in the building behind me, then the nurses will need to make our message known in other ways. As employees, each and every one of you have the right to file a complaint with the Minnesota Department of OSHA. You have the right to call them and ask them to come to your hospital and see the equipment and the preparedness plans that your facilities have that are supposed to be meeting federal and state laws. And those complaints that you make by calling become public record.
We just need to know we have the equipment to safely take care of our patients. We want to be able to go home to our families at night and know and not worry about whether we are endangering them because we've been exposed to an infected patient. We believe the state has a responsibility to protect citizens, including nurses and other healthcare workers. Minnesota needs to set standards that apply to all hospitals so staff, patients, and communities are safe no matter where they are. We are asking the state of Minnesota to do the right thing. Make sure hospitals are prepared for Ebola and other diseases. It starts with protecting nurses so we can protect our patients.
We could care for Ebola patients without any problem and without any fear if the government and hospitals just lived up to their responsibility. That responsibility is to protect staff, patients, and the public. Protect RNs, to protect patients. It's really that simple. We're calling on government and hospitals to do the right thing, to provide the optimal equipment, the training we say we need, and the staffing, and we'll be able to deal with anything. We just need to be sure we can do it safely and go home to our families knowing we're not putting them in danger or our neighbors or communities. I'd like to share a proclamation before I finish here. We, the nurses of National Nurses United, call upon President Barack Obama to address the imminent threat to public health posed by Ebola disease. We hereby call for an executive order mandating optimal national standards for personal protective equipment and for safety protocols to protect nurses enforced by the federal government.
Thank you, Jean. Those of you who have volunteered to care for patients who may be infected, you are all true heroes.